Interestingly enough, I think to start with the most important, fact that I pulled from it is 45% of men want to be bigger. But with this survey, again, 66% of men said that they were average. The size of the penis correlated with the height of the man and negatively correlated with being overweight.
Anything with shoe size?
No, but nose
or
size.
hand size?
Nose size. 85% of women said that they were satisfied, and 55% of men said they were satisfied with their size. So women tend to be happier.
We're more forgiving than you guys think.
Yes, and I think that, again, it's probably more in what the skills are with all the appendages. Like, subscribe, share with friends if you like the content we're putting out. So welcome back to RevMD podcast with me, your host, Dr. Debra Durst, and Faraday is with me.
Hey guys, how are you?
So we're back, and we are going to talk about penis size. So does penis size matter? This seems to be a very important topic, and again, based on even surveys, it seems that this is something that men are frequently thinking of. And
are polled on and have very strong opinions on. Guys, we know we don't have the equipment. This is not our arena, but it is something that is commented on frequently, so we figured we should address it.
Yes, it's on lots of different forums. Again, it's on comments, and we don't have the equipment. And we have some thoughts on whether that matters. But again, because we don't have the equipment, we want to look at what can be done and what you men think. And so again, we look forward to comments on this one. So
don't trash us for having the video. Comment and open the conversation.
Correct. And like, subscribe, share with friends if you like the content we're putting out. So a survey, and again, this was about penis size, and a lot of stuff with sex is survey based. And so it's just questions of, population, either men or women. And this was actually men and women. And it was a survey of 52,000 heterosexual men and women. And interestingly enough, I think to start with the most important, fact that I pulled from it is 45% of men want to be bigger. So that's almost half of men are saying they want to be bigger. So that's important, right?
Well, when you think about women, 48% of women polled they
True.
Don't like the way their vagina looks. True. So maybe this is just a trend across all genders.
Yes, like she's given equal time, and that's true. Like there was a huge survey, not quite as big as this one, but it also did a survey just of women, and it was 48%.
Unhappy. So maybe this just trends across all genders.
Yeah, so it was 48% of women unhappy with their vaginas. And again, I think I know why that is too. And we have, we talk to a lot of men and women each day. And so I think I have a good idea of at least what women think, but we wanted to hear what men think and what kind of studies are out there. And there was a recent study, which is what we want to get to today, on PRP and penis size. But with this survey, again, 66% of men said that they were average. And again, the size of the penis correlated with the height of the man and negatively correlated with being overweight.
Anything with shoe size?
No, but nose
or
size.
Hand size?
Nose size. Like I saw, again, there's rabbit holes when it comes to
this.
Of
course, that's why I brought up the shoe and hand size.
There's countries. Did you find anything on the shoe?
You just hear it, that it correlates. Look at their shoes, their hands, but I think it's all.
Shoe size, it's forearm. And
our camera guy said something about a forearm. I don't know.
I haven't heard that one either. But nose size does correlate with penis size, apparently. And again, we've heard, of course, yes, that hand size does. I don't know if that's the case. I didn't pull any studies for that, so I didn't see
anything on it.
No, I did see some data on nose, though.
But anyhow, interesting enough.
Yeah. 85% of women were actually satisfied. So 66% of men said they were average. 85% of women said that they were satisfied. And 55% of men said they were satisfied with their size. So women tend to be happier.
We're more forgiving than you guys think.
Yes. And I think that, again, it's probably more in what the skills are with all the appendages than it is just with, the penis. So I think that's why women probably tend to be happier, because it really depends on how they use it, right? And but you just okay.
My brain went 5 different ways, and I just figured the safest answer was, oh yeah.
I think I ever got just an okay.
Okay.
Ever.
That was the most appropriate answer I could give in that moment.
Like the first
that was
ever.
me having a filter for the first time ever.
Yeah, first time ever, honestly, because I've never been met with an okay. Yeah. But anyhow, so this, that's an interesting survey, obviously, size matters. And so what happened is in February 2024, and we do a lot of regenerative procedures for erectile dysfunction. And again, when it comes to size, you're a little more limited because there's been a lot of, talk around vacuum erection devices. And if you haven't seen our other video, checking that out on vacuum erection devices or penis pumps and size, but there's not a lot of studies supportive that.
Just like with filler.
Correct. And so the medical treatments for it would be filler, which can be used fat transfers. And, there's some, again, at-home type of things that men will do. And so that's more of a...
sound terrible.
Penis enlargement or PE type of things that they can do at home. So fillers, a medical treatment, you can do fat transfers, and you can even do silicone augmentation. And of course, there's the extreme of suspensory ligament surgery.
So surgeries where they cut.
A little bit about. I don't know that I've seen urologists actually talk about.
Sounds terrible.
It. Yeah.
Look that up. Don't do it.
No, the reports are definitely not in favor of ever using that as a way to get enlargement. And again, but the manuals, like the things that they do from at home is manuals, like traction devices, suspensory devices, but vacuum erection devices seem to be the most common. And again,
it sounds the least painful.
Yeah, the least painful. And it's actually men, like when they talk about it, they report, maybe a 1, 2, or 3% increase with that. And again, the studies and science don't necessarily support that. But now there's an interesting study that came out in February of 2024 in the Journal of Sexual Medicine. And it was Dr. Runnels and Dr. Brandi. And again, it was a small study, but still, it was a study that talked about PRP injection into the penis. That can be known as the P-shot if you're, in a group with Cellular Medicine Association and doing those and working within that, group to provide.
And then this study was men that had no previous issues, no previous treatments. Yeah. So I think that's always important to kind of know the baseline.
And they were 30. The average age was 30. And so
young guys.
Yeah. And there was, 20 to 55, average age of 30. So yes, no, previous treatments, no issues like as curvature, nothing that...
Medical diagnosis, nothing that would cause any issues. So just guys that wanted to change length and girth.
Yep. And they did a standard measurement. And again, they did pictures as well, images, so that you could see that. In baseline, they talked about, again, an average length of 5.75. And girth was 5.25. And, again, if you look at like that average length and girth, it, is variable in what you see, like 5.5 being length, 5.1, I think, girth. So there's, but I haven't seen a really solid across the board because, again, it varies per country. There's lots of different reports on that. But for them, 5.75 length, 5.25, and improvement in both. And so
and this is just PRP?
Just PRP. So just PRP.
So no shockwave therapy, no pumping, no vacuum erection devices, just
treatment with PRP injection. They did use ultrasound guided injections again into the corpus cavernosum. Is not that hard, and I didn't look at the technique to see if they did one injection or multiple injections. And then again, it's PRP, so it's your own blood, and you're using the growth factors from your own blood, so it's safe. There's no reported adverse effects with, obviously PRP from a long-term standpoint. Of course, anytime you put a needle in something, you could potentially get bruising or swelling, so that's common. But again, nothing long-lasting. And and no other injections with it, but just the PRP. And again, it worked. So length was up by 0.8 and girth was up by 0.47. And so again, there's a graph that kind of shows that that might actually project out to being bigger gains with repeat procedures. So it's a very, I guess, like it's small, but again, you're looking at something that does involve a foreign object, an injection of filler, it doesn't require a surgery. And again, the traction devices or penis pumps are great home, ways to potentially do this, at least based on a lot of forms of men. Not a lot of studies support of it necessarily, but definitely helps with ED if you're at an older age. But again, this is a great study for one procedure in office with no side effects.
That's regenerative.
And
that doesn't involve cutting.
Yeah. And actually, all of them had improved in function. So we saw improved length, improved girth, but also across the board, every single one of them had improved function. So that is good news because then again, you get all of it and it's regenerative, no pain, no downtime.
Now think if you add that with regular pumping and you add that with other treatments like shockwave therapy to help with blood flow. It would be interesting if Ronald did a follow-up study with those same type of men, same age, same precursors, and then added treatments.
Yeah. There are all kinds of, potential studies to show those regenerative treatments work. And again, acoustic shockwave, certainly we have another video that you can watch that talks about that with all the science related to that.
We've also done very in-depth videos on platelet-rich plasma for the P-shot. So if you're interested in learning more about that procedure, please feel free to look at our video.
Yes, we'll link some of those in the description. So please share if you've ever had a P-shot or a PRP injection, which again, we, go by P-shot in our office, then let us know your experience with that.
Or if you've had surgery, or if you've done any of these other different modalities, did they work?
Yes, because it seems across the board that men are happy with filler.
Yep.
And seems to be a very popular, addictive, no pun intended, type of procedure. And so let us know about that. So if you're doing stuff at home, manuals, you're doing the vacuum erection devices, you've had filler, fat transfers, let us know. And of course, the surgery would be very interesting. I
want to know all the comments, guys. Yeah. Like, I really want your participation in this. Like, what actually works? I was on Reddit. I read a lot of the comments, and it was eye-opening and entertaining. But it was eye-opening what some men are doing and what devices they're utilizing to try to improve and to enhance. So please comment.
And we're here to, again, we learn from you. We're here to learn from you. We want to provide the best and most comprehensive services. And why it's entertaining is men in their comments back and forth between each other is actually probably the most entertaining part of it. Yeah. So
enlightening.
And but anyhow, subscribe, share with friends. Let us know what you want to hear more about, and then again, let us know your experiences because we're here to deep dive into anything sexual wellness.